Okay, before we look at the postnatal changes, let me in brief emphasize the circulation, the flow. One, we said that blood comes in from the placenta. As it comes in from the placenta, it bypasses the liver through the ductus venosus. Then this blood is joined by blood from the inferior vena cava to the right atrium of the heart. So blood in the right atrium of the heart, some of it is gushed to the left atrium to go and pass through the pulmonary artery to supply the non-functioning lungs. Then most of the blood passes through the foramen valve to the left atrium of the heart. Blood from the left atrium of the heart comes to the left ventricle. And this blood is joined from the blood which is used up by supplying the lungs through the pulmonary vein. So blood also joins the blood in the left atrium of the heart, then it flows to the left ventricle of the heart. Blood from the left ventricle of the heart come and passes through the aorta, and the reason of passing through the aorta is to supply the upper extremities, that is by the descending branch of the aorta, supply the upper extremities of the body, and the descending part of the aorta supplies the lower extremities of the body. But because this blood is at a low oxygen level, this blood is helped to be rejuvenated by the ductus arteriosus, a shunt which joins the pulmonary artery to the aorta. And this one increases oxygenation of the blood which goes to the aorta to supply the rest of the body. So after use, blood from the upper extremities of the body is brought back by the superior vena cava, and blood from the lower extremities of the body is brought by the inferior vena cava. And all this blood is drained out of the heart by the hypogastric arteries back to the placenta for reoxygenation. So in brief, that is the fetal saturation. So after that, what may be the postnatal changes? Which may be the changes which occur immediately when the baby starts to breathe? We are saying that transition from fetal saturation to adult saturation occurs shortly after birth when the baby takes the very first breath. The major changes involve closure of the specific shunts and the redirection of blood flow to accommodate the newly operational lungs. So immediately the baby takes the first breath, there is a change in saturation, what we have called a redirection. And these temporal structures close because now the breathing is not going to start from the placenta, now it is starting through the lungs. And what happens? Closure of the ductus venosus. When the baby takes its first breath, there is a significant increase in the oxygen levels in blood. The ductus venosus, which allowed to bypass the fetal liver, begins to constrict and then eventually closes. The foramen valve closes. The increase in oxygen concentration in the blood and the mechanical changes associated with breathing leads to the increase in pressure in the left atrium. This increase in pressure prompts the foramen valve, a hole in the septum between the two atria, to close. This closure prevents blood from shunting directly from the right atrium to the left atrium. This is what we mean. That when the baby takes the first breath, remember somewhere towards second stage, there was placental site reduction, which was caused by uterine contractions and retractions. At the same time, you never know, we clamped and closed the cord. So what does it mean? That blood which was coming in through the umbilical vein was restricted, leading the shunts of the ductus venosus fall. But at the same time, there was a taking in of breath through the lungs. So what does it mean? This pulmonary vein, which was bringing in the oxygenated blood, now it is bringing in oxygenated blood to the left atrium. And this pressure in the left atrium will lead to the closure of the foramen ovale. And as the foramen ovale closes, it means now in the left atrium, there will be a very high pressure of oxygenated blood, of which this blood will be passed through the aorta to supply the upper extremities. And because there was reduced blood flow into the right atrium, the ductus arteriosus somehow also collapsed. Because the main aim why it was open is to rejuvenate the blood into the aortic system. But because we closed the placental supply, it means that the blood which was oxygenated now can no longer go through the pulmonary artery to supply the lungs. It means this one now closes. But instead, the blood now is oxygenated through the lungs. So what does it mean? Now the oxygenated blood is coming in through the pulmonary vein, and now it is supplying the aorta. It means now the foramen ovale is closed, the ductus arteriosus is closed, plus the ductus venosus, due to the first breath the baby takes during respiration, due to reduction of the placental site and clamping and cutting of the cord. There was reduced pressure from the umbilical vein. So these changes occurs immediately after the first breath the baby takes. So closure of the ductus arteriosus, the baby's first breath causes the lungs to expand, leading to increased blood flow into the pulmonary circulation. The ductus arteriosus, which allowed blood to bypass the pulmonary saturation, constricts and eventually closes. That one I've said. At the closure of the ductus arteriosus, redirects blood from the pulmonary artery to the lungs for oxygenation. So there is then increase in pulmonary blood flow as the baby starts to breathe. The pulmonary circulation receives more blood, and oxygenation of blood in the lungs becomes the primary source of oxygen into the body. With the closure of the ductus arteriosus and changes in the pressure of the heart chambers, the circulatory system transitions from the parallel fetal circulation to a series of circulation where blood flows from the right side of the heart to the lungs and then to the left side of the heart, supplying oxygenated blood to the body. And these shunts close and blood flow patterns change. The circulatory system of the newborn starts resembling the typical adult circulation, with blood passing through the lungs to get oxygenated before circulating through the whole body. So what we have been meaning is that immediately this baby takes a breath, the blood which was coming from the placenta ceases, and then the reoxygenation starts now from the lungs. Because in fetal circulation, the pulmonary vein was receiving blood from the lungs, which was deoxygenated. This time it is going to bring in oxygenated blood. So the blood circulate in the heart, the blood flow in the heart now will start in the left atrium, to the left ventricle, to the pulmonary artery, and then to supply upper extremities. Remember now this ductus venosus collapsed. So what does it mean? That blood from the upper extremities will be coming in from the superior vena cava, and it will come to the right atrium. Then as it comes to the right atrium, it will join the pulmonary circulation. And the foramen of valve will collapse, the ductus arteriosus will collapse, plus the ductus venosus will collapse. This will also lead to the collapse of the hypogastric arteries, because now they have no use of taking back the blood to the placenta. So they will also collapse. And these things will regain new names. And these are the names. Ductus venosus. Ductus venosus constricts and closes shortly after birth. Then it will be called a ligamentum venosum, with a fibrous band that will remain in the liver. So if in adult the liver is opened, it will have a fibrous band, which was a ligamentum venosum. Then the foramen of valve will also close in response to the changes in pressure and oxygen concentration when the baby starts to breathe. And the foramen of valve will come the fossa ovalis, which is a depression in the intra-arterial septum. It is a remnant of the fetal foramen of valve. They are saying it is a depression in the intra-arterial septum. So when the heart is checked, it has a depression into the two septums, which separates the arteries. And this is a remnant of the foramen of valve. It is called the fossa ovalis. Then the ductus arteriosus constricts and closes in response to oxygen levels and changes in pressure as the lungs becomes operational. So what is the outcome? The ductus arteriosus will be called the ligamentum arteriosum. It is a fibrous band connecting the pulmonary trunk to the aorta. So in adulthood, we shall see a fibrous band which will connect the pulmonary trunk to the aorta, and it is the ligamentum arteriosum, which was the ductus arteriosus intrauteri. Then the umbilical arteries, or the hypogastric arteries, which carried the oxygenated blood back to the placenta, they will also constrict and become functionally obliterated. The remnants of the umbilical arteries become the medial umbilical ligament. These are fibrous cords within the abdominal wall. So these are the remnants of the hypogastric arteries. And of the hypogastric arteries. So with these few remarks, I think we have come to the end of the story. Oh, I have not said that the hypogastric arteries will become the ligamentum teres. They will become the ligamentum teres, and they are the remnants of the umbilical arteries, which will be seen as umbilical ligaments within the umbilical wall. So that is in brief the postnatal changes after fetal saturation.